Good afternoon. I'm George Latimer, Westchester County Executive. It's 2 o'clock, and this is our Friday, May 1st coronavirus update. We enter the month of May in a continued situation where we're dealing with this outbreak of coronavirus that has changed our lifestyle and every element of the things that we're to do. But today we're here, as we have been the last couple of weeks, at the warehouse for the Emergency Services Department of County Government to recognize another group of individuals who've been extremely generous to the county and to the people who work in the county with the donation of PPE material, the things that we need when we're interacting with people that are exposed or have the COVID-19 virus. And these donations, and today 50,000 masks by the Greater New York Association of Car Dealers, Automobile Dealers Association, is really a wonderful contribution to the cause of good public health here in Westchester County. We're going to start off our program today by asking Mark Scheinberg, who is the president of that group, which covers the metropolitan area of New York, but he has a few Westchester connections, which we appreciate, to tell us a little bit about the generosity of the donation. And then he has one of our local businessmen here in Westchester County to talk about it as well. Mark.
Thank you so much, County Executive, and thank you for inviting us here today. I represent the Greater New York Auto Dealers Association, which has members of 425 new car dealers as the county executive in the metropolitan area. So from Long Island, New York City, Westchester, Rockland County, and even some of the counties above it. You know, one of the tragedies of when things like this happen, or one of the good things maybe that comes out of it, is that the community really does come together, and the resources that are brought to bear to try to help out has always been something that franchise new car dealers have looked to do. We had, as soon as this outbreak came and we had heard the real need to have face masks available for especially those that are most at risk, senior citizens and others that are there, our board of directors had authorized us to purchase 500,000 face masks on it and distribute it to the county clerks and the borough president's offices in New York City. Because this is where those relationships for the community are really important. So we've been traveling around over the last couple of days, dropping it off. I was in Brooklyn earlier today with the Brooklyn Borough President and the Manhattan Borough President, dropping off the face masks to really people who really need these kind of masks as quickly as possible on it. So we're very, very pleased to team up with the county executive on the distribution of this. As I had mentioned, is one of the things that franchise car dealers do, and they are small businesses located in all communities around the state and especially downstate area, come together that's on it. One of our dealers who have been a business person up in this area has been so charitable to so many different aspects of working with young people for careers in the auto industry, but also many other charities. I invited him here today because he is the representative of what New Car does and what business people do for the community on it. So I'd like to introduce Lou Giordano, who is the dealer principal of Croton Dodge Jeep Chrysler here in Westchester County.
Thank you, Mark, for the kind words, and County Executive Latimer. Appreciate being here today. We're honored to do this. And as representing the Greater New York Auto Dealers Association, as Mark said, I'm a dealer up in Westchester County in Croton-on-Hudson. And it's one of the benchmarks of what the Dealers Association has been doing for years. It's no surprise we'd be doing this. We have a coat drive every winter. I'm one of the drop-off points in Croton-on-Hudson. And I think over the years, we've collected some 50,000 or more. I don't have the exact number of coats that we donate. And even go far back as 9/11, and we were involved in donating vehicles for first responders, 9/11. So Westchester is our home to a lot of car dealers, and we try to do our part, and I think we do to help the community. Now, with this coronavirus epidemic that we're all facing, we're doing our part again to contribute to these face masks, which are essential, and we need them, even though we're feeling now that there's light at the end of the tunnel on this somewhat, better now than it was a month ago. We know there's still a shortage of these masks. And again, and I know they're going to wind up in the right place. And so here we are today presenting 50,000 of these masks to the county, and happy to do it. We're happy to do it. You're welcome.
Thank you very much, Lou. And the new realities of things, I can't give you a handshake or a pat on the back. But to both Lou Giordano and Mark Scheinberg, thank you very much for this generous donation. They're going to go to good use out in the community. We've gotten donations from lots of different organizations, in addition to the masks and the PPEs that we've had to obtain from the states and we purchased. But we know that they're going to be of great value. So thank you again, Mark, and all the other members of the organization, and Lou personally for taking the time to be with us here today. And we wish you much success in everything that you're doing. Thank you again. And we want to thank all of those organizations, and we've had quite a few that have donated to us. We've distributed them out, some through the municipalities, through the healthcare organizations, or some social action programs to try to get them in the city. We're at a point now where we're told by CDC that we need to wear masks when we're out in public. This is not part of our normal cultural situation. This is an odd thing that we're not accustomed to. When I leave the house, every day I have to remember to bring my wallet, bring my keys, bring some cash, bring my cell phone, and now bring your mask, because you don't know who you'll be coming in contact with. And you want to make sure that you're protecting them by you wearing a mask. I'm no scientist. I follow what you follow, and the professionals tell us this. And so this donation of 50,000 masks will help protect not just the people that are wearing them, but the people that those people come in contact with. So the multiplier effect could be really significant. Gentlemen, thank you again. Deeply appreciate it. For our Friday update, and we've been doing these updates on weekdays, so we don't plan to have a Saturday or a Sunday update unless something major breaks. We'll be back next Monday at 2 o'clock with the update. But the numbers that we've seen at this point continue to show the encouraging trend in Westchester County. Earlier in the day, Governor Cuomo gives the statewide analysis, and that statewide analysis is equally encouraging. But the state includes areas concentrated as New York City, other suburban areas such as Long Island, and then to the extent that you move further upstate, this is less of a contagion in upstate New York. There have been fatalities, there have been cases, but not to the same degree as we've had down here. Westchester was the first. And although we're not the worst, there is sort of a mindset that people look at Westchester and say, well, you're where it all began here in the United States. Accurately or inaccurately, that's a perception. So giving some numbers is helpful to know. We have a total number of positive cases tested. 29,232 people were positively tested for COVID. However, following the protocol that we're told is that after 2 weeks, a person that hasn't gotten sick is free of the disease. They're able to get an isolation release and therefore not considered an active case. 2 weeks ago, we had 22,476 people. So the difference between those numbers means that as of today, the number of active cases of COVID that we have tracked in Westchester County is 6,756. That's a lot of cases, but compared to where we were a month ago, we were 8,000 cases. And in the period of time over that month, we got as high as 10 and 11,000 cases. So we're almost at a point, not quite, where we're about halfway down the slope, the bell curve, where you start out low and get up high, then you come back down. We're not quite halfway back down the slope here in Westchester County. And as an indicator of how representative it is, we have tested 94,442 individuals in Westchester County to date. Now, as a proportion of our overall population, that's over 9% of our population. You hear some statistics out there where they're saying nationwide, 1% of the country has been tested, maybe slightly above 1%. In New York State, that number may be a little higher. 9% of all Westchester County residents have been tested. That is a high percentage, which means that the numbers have a little greater validity. But none of us are cocky about this. None of us know enough, frankly, about the science of the medicine to feel comfortable we're moving in the right direction. And that is a good sign that the number of active cases continue to drop. And now we've gone under 7,000 to 6,756. The other good news that we generally report on is the number of people that are hospitalized. The fear that we had was that a high percentage of the cases would be sick at the same time. We would have a very high level of hospitalization on any individual day or 2 or 3 or 4. And we would overrun the health system. That's what we saw in Northern Italy. That's what we saw in China dating back a couple of months. That has not happened here in Westchester. We've stayed in a percentage in the vicinity of 10 to 11% hospitalization. That percentage has been flat, but as the number of active cases drop, so do the number of hospitalizations. And it is, generally speaking, the people that are hospitalized for the longest period of time that are in the greatest chance to become a fatality. So we're hopeful that the less people that we have hospitalized, that will start to lower the amount of folks that we lose. But we have deaths every night. And we now have 1,049 Westchester residents that have died from COVID or COVID-related illnesses. And that period of time stands for 2 months ago from today, from March 1st to May 1st, 1,049 deaths. That's a lot of Westchester residents to lose in a very short period of time. As a percentage, that's about a 3.6% fatality rate, and that's tracked against all the number of positive cases we've had. So of all the people that have tested positive for COVID, 3.6% of them have shown fatality. Demographically, it is heavily skewed by age. If you're 60 years of age and older, that amounts to 85% rounded number, 85% of the deaths in Westchester County. When we have the cutoff at 70 and older, that's 65% of the deaths as a rounded number. So clearly this is affecting people in a certain age cohort. And it may very well be that the younger members of the family are the ones that transmit it to the older members of the family. The younger folks get it, are asymptomatic, means they don't show any symptoms of having the disease. They go through the 2-week period of time. Maybe it manifests itself as a cold. Maybe they're slightly ill. Maybe they're not ill at all, but they have the disease and they pass it on to somebody who's older, potentially more sick, and then much more potential that they may lose their life over it. But we have had cases of otherwise healthy people under the age of 50 as a percentage, as a number, not as many, but there are cases of that where people who had no apparent reason to contract the disease did, and in some cases die. So we have to treat this as the killer that it is, and important to understand that we're heading in the right direction, but we have not arrived at the right end spot. And that's why we continue to need the kind of material that was donated today to help us deal with this. Westchester County is beginning an active antibody testing effort that begins this coming Monday. It'll be held at the county center. You know from past reports that the county center has been turned over to the state health department, and it's been turned into a medical facility. And at that medical facility, there'll be something to the tune of 400 people a day that will have blood taken and will be processed. And we'll find out if they have the antibodies to fight COVID-19. And this is done through the Westchester Medical Center, the tertiary care medical facility that's here in Valhalla. It's on the same campus where we are today with the county warehouse. Very wise people who ran the county government many years ago bought a very significant tract of land. And it's on this location that we have our correctional institution. We have some environmental facilities here. The labs and research component is here, Woodfield Cottage, on and on. But within this campus, now a separate entity from the county government, Westchester Medical Center, will be doing the blood taking and the processing of the test. And we are targeting the first responders, the police, the fire, the EMS workers, first with the county and then with cities, towns, and villages throughout Westchester County. That is the primary focus. Once we satisfy those numbers, which may take the better part of a few weeks, it will then be opened up in a way that members of the public can be able to do it. But we specifically want our first responders to be able to go through the antibody testing and see the results of that testing. At the county level of government, it involves our county police force, our Department of Public Safety as it's officially known. It involves our emergency services worker, which are the people here and in some of the other locations under the direction of Commissioner John Cullen, who is in the room with us today. It will also involve our health department, our probation department, and our correction officials as they come in contact with people that could potentially be compromised. And so the testing for antibodies from there will go on to the police departments of all the various localities, starting with the big cities, the fire departments, and of course, some fire departments fire services are structured through districted fire systems, not through the town or the city. Some are volunteer. And then of course, with EMS, same situation. Some are contracted out. Some of them are volunteer services. We'll work through all of that. Susan Spear, who's on our team, who's here and camping out here for the better part of the last 2.5 months, is going to be the point person on all of that. And she's going to have, as she already does, more work than she can handle, but she's very able to negotiate this stuff and help working through the medical center to get those groups tested. And when we test those individuals, there are a couple of key benefits to our first responders. Number one, these people are the ones that we need to have on the job. We need to have our police, our firefighters, our EMS people healthy and on the job. Whenever we have a significant number of vacancies, people are home sick in any of those three areas, we can't provide the level of service that we need to provide. And these are the people probably in the order of EMS first, fire second, police third, that interact with people that are ill, whether from COVID or not. And the need of having them on duty is essential if we're going to function. So to have them tested, know that they have antibodies, know that they can go back to work, because in generally, you're less likely to get the disease. As we're told by science, you're less likely to get the disease if you've had it and you've gone through it and you've developed antibodies to deal with it. It also allows those individuals to donate blood. Plasma and other materials from the blood can be used to help treat those patients that are severely ill. We do not have a cure for this disease. We do not have a vaccine or an antiviral. As I've said more than once before, it is really wrong-headed to talk about cures as if there's a treatment that will automatically beat this disease. We can go right back to where we were in mid-February. But blood plasma is one of the things that is helpful to the medical community in dealing with patients who have COVID-19. So to have the force of first responders, once we know that they have antibodies, and those antibodies can be used to help fight the disease, it's helpful to know those individuals and try to get that effort. So antibody testing at the county center, done in concert with the medical center, is on the docket, starts on Monday, and at 400 tests a day, we hope to go through all of our first responders and then use that capacity in other ways going forward. On the topic of testing, you've heard a lot about nationally how we have to test in order to be able to pull out of this, to be able to open up parts of the society. The decision on opening up most of what has been closed belongs to the governor, Governor Cuomo, and he wants to do things regionally with Governor Murphy of New Jersey, Governor Lamont of Connecticut. As a county executive, I have some executive authority, but it is wise to operate on the broadest possible level. So I think it's wise to have the governor, in concert with other governors, make decisions that would affect the full metropolitan area. With that thought in mind, they also are responsible, the state is, for authorizing testing for COVID-19, not the antibody testing, but those that will determine whether you have a positive or a negative test. And I just want to mention that now the number of those testing sites have really multiplied. We originally began this contagion 2 months ago with county health department nurses and state health department nurses going out to a person's home and applying the test, a team of people doing the swabbing, collecting the samples. It was laborious. You could cover a certain number of people a day, but certainly not a large number of them, even with multiple teams out there. Now, over the course of these 2 months, we all are aware we have the drive-through center at Glen Island in New Rochelle, which the county contributed the use of the land. The Westchester Medical Center, again, right here, also has a drive-through situation. A week or two ago, we opened up the Mount Vernon Neighborhood Health Center as a walk-in location. The St. John's Park Care Center in Yonkers has been opened at a walk-in station. All the hospitals of Westchester County now have the capacity to test for COVID-19. They have focused on their patients and their staff as a primary situation. But if you are affiliated with any of those hospitals, you can certainly talk to them and discuss those kinds of things. But White Plains Hospital, Mount Vernon Hospital, which is a Montefiore facility, Montefiore, New Rochelle, the hospitals in the New York Presbyterian Network, which include Lawrence Hospital in Bronxville, the site in White Plains, and then the Hudson Valley site in Peekskill, the Northwell system, which has Northern Westchester Hospital in Mount Kisco and Phelps Hospital in Sleepy Hollow. Each of those systems have the capacity to process testing, and COVID-19 testing is available through those hospitals. We also have a number of networks that involve urgent care locations, the CareMount system, which is located around the county, heavily in the northern part of the county and into, I believe, Putnam County. Physicians One Urgent Care is now setting up some testing capacity as well. The Open Doors system of neighborhood health centers, Ossining, in Portchester, in Mount Kisco, and Sleepy Hollow. So there are now a multiple number of testing places for individuals to pursue, finding out whether you're positive or negative in COVID-19. As has been talked about now for better than 2 months. If you are positive, you need to isolate for 14 days, not have contact with other people because you will be contagious to them. It's a highly contagious disease. That's why we're now wearing masks, to make sure that we're not conveying this through anything that we breathe or anything that comes to our respiratory system. But a number of different testing sites are available. If there are any questions, folks can contact the county government. We'll be happy to tell you about that. You can give us a call, 995-2000. Ask the county executive's office. Any of our offices will be able to help you out, give you that information. The county is working directly with the state of New York on the issue of nursing homes. There's a lot of concern about the status of the people who are residing in nursing homes. By definition, they're people who have illnesses. That's why they're there. They are generally older in population and much more vulnerable to the COVID virus. And we've seen that has been a source of a certain percentage of the fatalities in Westchester County. The statistics reside with the state. They haven't necessarily given us an update on them, but we know that some significant percentage, certainly north of 30% of all the people that died, have come through the nursing home conduit. And now the state health department and the county health department will be working together on a game plan. It's not, ready to be announced yet. I suspect the governor may make an announcement early next week and what that's going to look like, because you'll be doing this with other counties as well. And then we'll follow up with what that looks like, what kind of an ongoing effort. But an ongoing effort is being made to deal with nursing homes. I want to mention on the economic development front, we've talked about how our economic development team is working with small businesses to try to help them apply for the federal loan programs, the Small Business Association Administration loan programs, the SBA's EIDL program, EIDL, Economic Injury Distress Loans, and also the PPP, the Paycheck Protection Program. These are programs you've read about. They ran out of funding a couple of weeks ago. They got refunded. And so now there's an effort being made to help people qualify. And we're also hoping some different events might be helpful. The economic development team is scheduling a workshop which will be addressing certain issues that can be found on our website, The Catalyst, CATALYST. It's going to be coming up this Thursday from 1:30 to 2:30, and that's sponsored by our economic development team. We hope that will be a helpful seminar. It's not the only one we've done, but we hope that we can be able to be helpful on some of these economic development issues. I'm going to mention very briefly that this weekend we have made some decisions on our parks and recreation facilities. We've talked about this every meeting. It's probably just unnecessary repetition if you've seen other reports, but if you're tuning in for the first time, you haven't seen us in a couple of days. Last weekend, we opened 2 of our 6 public courses, Hudson Hills in Ossining and Mohansick Golf Course in Yorktown. We had them open a few weeks ago. We shut them down. They had a couple of weeks rest off, and we opened them up last week, and we've had no incidents over the weekend nor during the week. We've had no complaints from people that have seen inappropriate operations there. The protocols have been put into place, 1 individual per golf cart, the spacing when you go to the pro shop, the protection of the pro shop workers, a host of different things that are designed to protect the golfers. With that thought in mind, this weekend, we're opening 2 more of the 6 golf courses. We're opening Dunwoody in Yonkers and Sprain Lake in Yonkers. We are not opening yet Saxon Woods or Maplemore, and we're going to do the same thing we did last weekend. We're going to see that we've applied the right principles and that it works. I've said this before, we'll say it again. Golf is intrinsically a socially distancing sport. I don't play it. You may not play golf. You might have attitudes about what golf is as a sport, the use of land for golf. But whatever it is, as a recreation, this is a county with lots of private golf courses. The public golf courses are made available so that there's a less expensive way for the average person that wants to enjoy golf to be able to afford it. For those who have the wherewithal to be members of Wingfoot or Westchester Country Club or Sleepy Hollow or many elite courses in this county, there are many of those golf courses there. Those that have the capacity to be part of it have every opportunity to be that. But for the average person who wants to play golf as a recreation, we have these 6 golf courses. They've been in function for a long, long time. They're attracting attention now, but we think that opening the 2 courses that we intend to open, we will manage the process. Masks will be required. We'll also make sure that there's social distancing, and golf is naturally that. To the extent that anybody knows about the sport, when you tee off, you do not have a fellow golfer in close proximity to you. When you putt and hole out of a green, you do not have somebody in close proximity to you. And Lord knows, as you're playing the ball down the fairway, no 2 golfers hit the ball in the exact same spot. There is a resentment toward golf that some people hold. I can appreciate that everybody's got a right to an opinion, but that opinion shouldn't govern whether you can socially distance the sport or not. We've left open hiking trails. We don't have a debate about the role of hiking in our society. And we'll talk about bicycling in a second, but we have bicycling on the North County Trailway, the South County Trailway, because they are intrinsically socially distancing events. If you were going to play touch football, that's something I have played. If you are going to play basketball, something I have played poorly over the years, there's no social distancing in basketball. There's no social distancing in touch football. You are in the face of the other person playing. And so it makes logical sense for us not to permit those sports, and we don't. And right now, we've talked about this numerous times, what happens when you open up a public beach or swimming pool. People will be in close proximity to each other, and that would help spread the virus. That same philosophy does not apply to other recreations like hiking, in our judgment, biking and golf. And so you need to understand that this isn't a willy-nilly philosophical decision. This has been thought through, and we've looked at the nature of what the action is. And so we're very confident that when we open up Dunwoody and Sprain Lake this weekend, we will be opening up an effective recreation for those people that choose to use it. And so obviously, if you don't want to play golf, you don't go. And you can stay at home if you like. You can take a nice walk with somebody if you want to do that. That's perfectly within your power. But for those people that do play golf, for whom that is a recreation, we want to be able to make it available under the right set of circumstances. We are also opening this weekend Bicycle Sunday. I've heard some critics make some criticisms about Bicycle Sunday. Once again, it is not going to be managed the way it was in pre-COVID days. We intend to enforce social distancing on the Bronx River Parkway. We close the Bronx River Parkway for a few hours on a Sunday morning. The northern terminus of it will be at the Main Street exit for White Plains, not an exit further north of the county center. The county center, as you know, is all set up for the medical purposes. And it goes down to Bronxville, where there's the split of the Bronx River and the Sprain, and that's where it ends. And it allows, generally speaking, recreational bike riders to use it. We will not have the more skilled bicyclists that are part of bicycle clubs that will bicycle in sort of race formation, close tight corners as they move through sort of the Tour de France or the Tour de Westchester type of biking. That's not going to happen here because this is recreational. You have little kids with mom and dad, and they're moving at various speeds locally, and that doesn't lend itself to that type of more formal bicycling. There are people who believe that any activity outside of the house spreads the virus. You have a right to your opinion. This is a democracy. But that doesn't necessarily mean that your opinion is the right strategy for a society that has people very different from the way you live your life. And we have restricted, and happily so, many restrictions of life that I would otherwise like to see lifted. I would like to be able to go out to a restaurant, go out to a bar, get a haircut, which if you follow me every day, this is ridiculous. But the bottom line is those actions, going to a movie theater, those actions are closed down in the society. So you look for opportunities where people can enjoy themselves, get some exercise, have some mental health release by being out of doors in a positive environment. And that's what we're doing by doing this. If you disagree, I respect that you disagree. But the bottom line is we believe that this is right. And I think it's being backed up by the numbers. We have kept open Kensico Dam Plaza, Playland Boardwalk. We've heard the criticisms, but we have a diminution in the number of active cases, and we have a diminution in the amount of hospitalizations. So we believe those numbers prove that we are not advancing the spread by limited recreational activities. We think we're doing the wise thing, and we hope that the people of Westchester agree. Now, if we cannot maintain social distancing on Bicycle Sunday, if we cannot maintain social distancing at any given park or any given golf course, if for some reason there's a cluster at one of these locations, we will shut that course down. But we won't do it because of ideology. We'll do it because of pragmatism and practicality, because distancing cannot be enforced at that particular location. And I would point out to the people that are coming by to look, because I go by and look at these different locations every weekend. I spend most of my weekend trying to make sure that we're making the right decision and testing ourselves. If a park is open from all day, from 7 o'clock, sunrise at 6 o'clock now until sunset, almost 8 o'clock at night, you might see it at one point in time of the day, 1:15. At 1:15, you might see some examples where people are not social distancing. But if you sit there for an hour, you'll watch what normally happens at a park. There's an ebb and flow of people. And almost never do you see the same few people standing in a location more than 10 minutes. They move around and they move about. So I get reports once in a while saying, I was there and I saw a big crowd. Did you take a picture of it? No. What time were you there? I don't know. That doesn't help me much. If you say it was at 2 o'clock, and we ask for a report from our staff people, they say, yeah, 2 o'clock, we had to break up the group a little bit. And then you find out that the person who's complaining wasn't actually there at 2 o'clock. They drove by, they saw a bunch of cars, they took a quick look. They thought they saw a lot of people in close order. You may or may not have the right depth perception when you're looking from a distance. And they immediately assumed, oh my God, this stuff is all breaking loose and no one can control it. I go on and on about this because I know what I'm going to hear this weekend. But if we manage this properly, it is a necessary and valuable recreation for people's physical health and for their mental health. And I will assure you, this culture of ours as Americans, it's hard to adjust to putting on masks all the time. It's hard to get people to shelter in place. We're not accustomed to that. And if you don't give people a reasonable outlet, not a do whatever you want outlet, but a reasonable targeted outlet, they will still go out. I'm much more worried about the spread of the virus in our urban centers, in areas, and I grew up in one of them, where people are close together, apartment living, no green space when you come out of the apartment building, and people, the weather gets warm, there's no air conditioning in your apartment. I've been through that scene. You're out on the street corner, and it's very hard to break up that social distancing. But meanwhile, some people are upset, and they're over here worried about how many guys are golfing when the real problem is here. And we need the strategies to deal with the problem where it exists, where the cluster is. So you've heard me say this more than once, but I repeat it because we're Friday and we're going into a Saturday where we're going to open 2 golf courses and a Sunday where we're going to do Bicycle Sunday and see if it works. Doesn't work, we'll shut it down. But if it does work, we're going to keep doing it because we think we're doing the right thing. With that, I'll go to questions. Emily Lavin from our communications team is with us, and Catherine Chaffee is in a remote location. Any questions from our friends in the press?
We have one question from Lanning Taliaferro. How has the county gotten involved in the problem of capacity with local funeral homes and cemeteries?
Okay, the question, if you didn't hear it, Lanning Taliaferro from the Patch asked about how we're handling the issues with, in essence, fatality management, the large amount of those who have died and from hospital or nursing home to funeral parlor to gravesite has become a massive problem for us. We're working with funeral directors right now. We're working with the cemeteries, and we're trying to open up as much of the bottlenecks in the process as we can. We know that under normal circumstances, almost all funeral homes do not have the capacity to retain the deceased loved one beyond a very short period of time. Under normal circumstances, the funeral home will pick up the deceased from the hospital, we'll have a wake, we'll then move them on to a cemetery and so forth. And now that you've had, just in our county alone, over 1,000 people die within a very tight period of time, that has overloaded the system. At the county level, we have obtained, it's fairly gruesome, we've obtained refrigeration vehicles that will allow us to maintain those who are deceased so that we can hold them long enough to let the process as many people as can go through this. For those people that are waiting for cremation services, those are not easily able to be done at a moment's notice. There is a certain capacity for the amount of cremations that can be done in a certain period of time. And that portion is a larger portion of the fatality group than I might have thought. And that backs up the process and then the amount that the cemeteries can operate with. We are not having wakes as we know them for those that are part of that tradition. We are not having graveside funerals as we may know them. We think that for most people, we're going to have those opportunities to honor our deceased friends afterwards, after this is over, and when we can then cluster the proper way. But we're working with capacity issues and trying to move the pipeline to open up. We're slightly benefited today by the fact that there are less fatalities. We had 18 fatalities last night. That's the lowest number we've had in quite a while. Still a lot of people. On a normal night, we don't lose that many people in Westchester County, but at 18, there are nights we've lost well multiple of that number. So as the number of deaths are less, we're a little bit able to manage the process, but we are behind and there is a storage capacity issue. And I hate to sound clinical about this because the one thing that you don't want to forget when you're doing these updates, whether it's the mayor of New York City, the governor of New York, the president of the United States, any of us, this is not a statistical report to people about how many people have died. This is not just a report about how fast we're going to get the economy going. Let's get the economy going. Come on, come on, come on. It's about the loss of human lives. It's about the loss of people we know, people we love, people we're related to. It isn't personally my parent or my significant person in my family, but I've lost many friends, and the people who have died are somebody's spouse, father, brother, co-worker, someone you know from your religious institution. And so there is this human element that has to be taken into account. So we're trying to show for those that have died as much dignity as we can show them in what is their final moments on this planet. We intend, we'll probably announce this next week, we intend to have an area of one of our county parks set aside for remembrance purposes, in which we'll have a program and we'll invite families to come and remember their deceased ones with ribbons and a way to maintain that. But we're managing the fatality situation, Lanning. It's difficult, and we're managing as best as we can. And we're trying to use as much capacity as we can to move as much as we can. And obviously, if the death rate continues to drop, we'll get caught up and we'll be at base zero. Any other questions that we have?
No other questions.
Okay, so for any of our friends in the press that may be watching, you're certainly welcome to give us a call. Catherine Chaffee, our Director of Communications, would be happy to put us in contact if there's some other element of the story that we need to comment on. But with that, I want to one more time thank Mark Scheinberg and Lou Giordano, who are here with the Greater New York Automobile Dealers Association, for their great generosity today. I want to thank John Cullen and the men and the women of our Emergency Services Department, who do an unbelievable job of moving product in and moving product out, and doing this on a continual basis. This is a job that is never done. Until this contagion is over, there's going to be people coming to pick up hand sanitizer, coming to pick up PPEs. And I might add, there's never enough of it. Even when you give an institution a delivery, it lasts them for a couple of days and they're right back at the door again, needing more, legitimately needing more. So John, you and your team get credit for us for all the hard work you're doing. She's not in the room, but Dr. Shalita Amler, our Commissioner of Health, has been on a 3-month, she actually was focused on coronavirus in January. She has, and her team have done an unbelievable job. Those nurses that are out there taking the swabs, that puts them in danger. And we should appreciate the work that those nurses and the other medical professionals do as part of all of this. And then we have other parts of our county operation, our county family, the people who drive the Beeline bus system, and on and on, the police officers who are out there patrolling our parkways and dealing with issues at a moment's notice in the age of COVID. None of these jobs are easy. We respect them all. And our job in our management of the county is to try to do right by our people and our workforce in this time that's exceptional and for which there are no roadmaps. So with that, thank you very much for watching. George Latimer, Westchester County Executive, will be back at 11 o'clock on Monday morning. Facebook Live, one of our COVID conversations on that day. I believe we have Commissioner Sheriff Tom Gleason from the County Department of Public Safety will be interviewing on Monday morning. You can take a look and you'll see an interview we did earlier today with Michael Facina, who's the president of New York Presbyterian Lawrence Hospital. We had that conversation earlier today. It's out there on Facebook just to keep you updated. Have a good weekend. Stay safe. We'll see you on Monday.